The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and we encourage you to please continue participating in the program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you and the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing cancer in terms of its treatment, its prevention, and its identification.
Cancer is one of the most leading causes of death. It is clearly a most serious disease. Joining us this evening is Dr. Sandeep Malik, an expert in the cancer, or as we refer to it, the oncology field. Dr. Malik is widely recognized and also, most importantly, has extensive experience in the oncology area.
All right. Now, before we hear from you, Dr. Malik, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Dr. Malik, let me start the program by asking you to share with our viewers the progress that is being made in cancer treatment.
Well, thank you for the invitation. Cancer or oncology is one field where a lot of strides have been made in terms of what we know as what causes cancer as well as how to deal with it. Just to give you some sheer numbers, it continues to be one of the major public health problems. In this year in particular, we would see about 1.6 million people who will have cancer, and about 560,000 or so of them will not make it. But so much so, the cancer deaths peaked at around 1991, and since then about 20% or so lives have been saved of what it could be. Cancer has moved from one big treatment or one generalized treatment into something like a personalized care now. Many of the situations we know what causes cancer. We are turning into the genes. We are trying to see why genes sometimes start acting weirdly and why it becomes the cell becomes weird and becomes into a tumor. And so much so, the treatments also have evolved. If someone looks into what medications have come out into the past few years, many of those are oncological related products. Many of those are biological compounds, which means they are not the chemicals which people might be worried about, that they lose the hair or they affect the blood counts and so on. These are specially targeted compounds which go in and actually hone in on the cancer cell and take care of it without affecting the rest of the body. So
there's definitely hope out there, and progress.
There is a lot of hope, there's a lot of interest, there's a lot of research which is happening, and doctors are excited, patients are all excited, and there's a lot of community support also in terms of what we can do with cancer or oncology and where we see the field headed from here on.
Okay. Right. Can you provide for our viewers a general description of cancer and how it develops and spreads? Just, briefly and clearly.
Yes, of course. So normally what happens is every cell, body is made up of hundreds of millions of cells. Every cell has a defined role. It has a lifespan, so it comes in, it has an organized life cycle, and after that it goes away. Sometimes what happens is the cell loses the potential to, let's say, divide and develop and have the defined role. It kind of keeps on dividing and dividing and dividing, and finally becomes a heap of tissue. So that thing can affect the surrounding organs, that thing can spread into some of the other places of the body, and it's kind of no good use to the body but causes problems. We call that tissue, or we call that process as cancer, just putting it into layman's terms. And the whole goal of oncology is to prevent it from developing, and if it is going to develop, in a way to find it out at an early outset, and if it is there, then get rid of it.
Okay, now what are the screening methods that you and your staff use in the detection of cancer, and how reliable are they?
There are several cancers in which we do promote and we think people should be screened. Just as a definition for viewers, what is screening is, we want to find out that there is a problem before the problem actually becomes a problem. So before the tissue is going to become cancerous, we want to identify the problem. We kind of divide the cancers into based on where they are originating from. So the big ones in which screening has shown to have a big role are colon cancer, breast cancer, prostate cancer, in which there is a little bit of controversy now, and some of the other special situations, for example, lung cancer. So starting off with colon cancer, this is something that we can prevent from even developing into a cancer.
You may have referred to this before. In terms of incident rates,
yes,
what are some of the most common cancers, and how successful are we in treating these cancers?
So just looking
clearly,
So just looking at the sheer numbers, in men, prostate is a big one. Prostate, and then lung, and then the colon. And in the women, it becomes the breast and the lung and the colon. Lung cancer, fortunately, is decreasing. We hope it continues to decrease as people...
Why is that? Why is that? I mean, I know, and everyone knows, but I just want to hear it from you. Why is lung cancer decreasing?
Well, the community realizes, people realize that smoking is not good. Smoking is one of the biggest environmental culprits when it comes to formation of cancer, and that could include anywhere from the aerodigestive or the genital or urinary tract.
You mean the upper airway?
The upper airway, the gastrointestinal tract, as well as...
Keep your language to the patient.
So smoking or tobacco is not good. People are into, let's say cigar smoking or chewing tobacco and so on. Tobacco in any form is definitely not good. It promotes carcinogenesis, it insults the normal lining of the mucosa or the defense mechanisms we have, and it definitely promotes cancer to develop. Fortunately, people do realize, or many of them do realize, that this is a problem, and years ago people started to stop smoking or kind of getting away from it, and the lung cancer incidence peaked, and since then it has been gradually falling. Women were a little bit late to come on board, so we noticed that the cancer or lung cancer incidence or the prevalence has continued to decrease, but it started a little bit late in women. And we hope that that trend continues. This is something which we don't need, we don't want, and it's purely in our hands as to when we want to smoke or if we want to smoke, and this is something which we should not be doing at all.
Now let's explore in greater detail the guidelines that oncologists such as yourself use in terms of identifying and determining cancer in the first place.
So oncologists tend to follow the American Cancer Society guidelines. There are several other societies which do put out guidelines, for example, the U.S. Preventive Task Force. So ACS recommends for someone who's over 50 years old, talking specifically about colon cancer, that someone should be screened for colon cancer. We have several options available. Our hospital is one of the places where we have several good physicians as well as the capability to deal with this. We have simple tests like a flexible sigmoidoscopy, where the doctor puts in a very thin tube or a telescope, you could say a camera inside the bowel. It goes up to about 60 centimeters, which comes to the left side of the stomach wall, goes into a large bowel. You are able to visualize where the problem lies, which is usually a small growth or polyp. It can be a cauliflower, it's like a small polyp or mushroom sitting there. Doctor snares it and the problem is gone. No more cancer, that thing is out. It takes about 8 to 10 years before that thing could become cancerous. So if someone starts doing this at age 50, that is gone. The doctors also promote something called a colonoscopy. Now the whole of large bowel is being screened, And by this, once this is done, for the next 10 or so years, an average risk person is good to go. If someone doesn't want the invasiveness of the procedure, we have other options. Double contrast barium enema, in which nothing is inserted. We just put a contrast or a liquid inside, and then we take the pictures. The radiologist looks at them. If there's a problem, then
But that's for the colon.
Yes.
And the stomach,
Yes.
basically tubes looking in.
Yes.
What about the lung and the breast
The breast.
and the prostate?
Okay. So all these three are a little bit controversial now. So if someone is looking into the news and following the news, then there is a little bit of controversy. So much so for breast cancer, American Cancer Society says that any woman who turns in 40 should start getting screening mammograms done. These are fairly easy. The women have that notion that they cause discomfort. But on the other hand, it takes a pathology.
I think it's realistic.
Yes.
Some women feel the pressure more than others, but it's there and it shouldn't be minimized.
Well, this is all correct, but now we have digital mammograms, for example. The technique is better, and the staff knows what is what, and then once the woman gets into it, then they realize what it is. So much so, American Cancer Society says every year the woman should start getting the screening mammograms done. But the U.S. Preventive Task Force says that every 2 years also it is all right. So I would say that if you at least get it every 2 years, starting at the age of 40, then most of the times the woman is good in terms of.
What about the lung?
The lung, in the years gone by, we didn't have a good test to promote as something that we could use as a screening test in which we are going to detect it early. But recently a study came out. It was NLST study, which is National Lung Screening Trial, and the results were proposed. And now it seems that someone who is at high risk of developing cancer, that someone is someone who falls into the age groups of about 55 to 70.
Just a minute. We have David asking a question that's very pertinent.
Yes.
David, you have a question for Dr. Malik.
Yes, I do, doctor. Thank you very much. My question is, does diet play a part in a person's coming down with cancer? Is there anything you could eat that, for example, a different kind of diet would help you out and stuff like that, or is it just eating randomly can contribute to this?
Okay, I think you said you want to know what role does diet have in cancer, right?
Yes, sir.
Okay.
Well, David, you are right on the mark when you think about diet and cancer. It's kind of well known and well defined that refined foods as well as red meat and processed meat, that leads on into cancer development.
What do you mean by refined stuff? I know.
Well, anything which nature has for us is kind of good, just putting it into layman's terms. So fruits and vegetables, about 2.5 cups a day is what we need when we say healthy diet.
Okay.
So red meat is kind of not good, and as well as something which we fry, for example. And if you go into these fast food joints, so the kind of stuff that we have over there, this is not good for the body. So besides causing other issues, for example, heart disease and cholesterol and whatnot, it does cause problems in carcinogenesis also.
Okay, so what should a normal person eat?
More fruits and vegetables, about 2.5 cups, as I said, a day. Whole grains are better than other ones. Whole grains, fruits and vegetables. And stay away from the red meat, or less quantity is better. And alcohol is in moderation. So for moderation is for a man 2 drinks or less a day, and for a woman is 1 drink or less a day. And if the person stays away from it, that's even better.
Okay. All right, David, thank you very much for the question.
Why do you think there is so much controversy surrounding the breast cancer as well as prostate? And what are your specific recommendations?
So building up upon the breast story, it seems that women who get the breast cancer at an older age, they have what we call indolent or slow growing disease. So the thinking is, even if we do the mammogram every 2 years, we would pick it up and then we would be all right. The next thing is younger women, younger meaning women between the ages of 40 and 50, they have little bit of dense tissue. So the mammogram sometimes picks up things which may not be real, which leads into more interventions. By interventions, they undergo, let's say, an biopsy and ultrasound and more aggravation and anxiety and so on. Last but not the least, many of these genetic conditions, for example, the BRCA syndromes and so on, which result in increased cancer development, they grow at such a fast pace that the 1 year duration in between may not actually pick it up. So
what about the controversy in prostate?
So prostate is a real problem. American Cancer Society still says that anyone who's over 50, that someone should have a discussion with the doctor, and both of them should decide what the risk and benefits of the testing are, what it involves, and then we look at the longevity of the patient. By that what we mean is the person going to be around 10 years from now? And then we propose testing, and testing which used to be just a blood test or PSA testing, and followed by, based on what the numbers are and what the velocity was, which is how fast it is increasing, sometimes we go on to do the biopsy. The problem became that, when this was offered to everyone, it looked like it wasn't actually resulting in lives saved without problems. We needed to check thousands of people to actually find a problem and then save someone from cancer. So unnecessary procedures were being done, and some of the complications which can actually affect the quality of life were being resulted into. Examples being, let's say, impotence or urinary incontinence, which is the person continuously leaking.
Now, on that note, Dr. Malik, let's pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx, Lebanon. Our dedicated surgeons and professionals